If you're experiencing low back pain, buttocks, aching in the leg, tingling, numbness, this video is definitely going to be for you. These stretches I'm going to show you, we're going to work our involved side. Mine is going to be my left side. It's always good to do both sides to balance the stretching off on both sides of the body. So I'm going to pretend I'm getting aching in my left buttocks, discomfort in my leg, and difficulty sitting prolonged periods of time. It's affecting my sleep. On my left side, we're going to address the first thing. We must stretch those hamstrings. You're just going to extend your leg out the best you can. Some of you may have a hard time extending it all the way and leaning forward. When you lean forward, you may notice the knee is bending. That's okay. I just want you to lean forward the best you can. Put your forearm on your knee or above your knee and just lean forward. Just hold that position. I know it may hurt. Just hold it to the point where you can't go any further. And you're going to hold that there a good minute. You're going to feel stretching in there. Then, while you're doing that same position, I want you to lean a little forward. You're going to get the inner groin, the adductor muscles. You may feel it into the pubic area, which is good. These muscles all on the inside of the thigh attach in that pubic area, which can be very, very sensitive. This can affect your pelvic floor as well. So you're going to lean forward, you'll feel that nice burning, and you'll hold that there for 1 minute as well. And in the buttocks on both sides, we have what they call the piriformis muscle. That muscle runs from the lower part of the sacrum to the hip joint. And when that muscle contracts, the nerve underneath there is called the sciatic nerve. That sciatic nerve is the largest, longest nerve of our body, about the size of our thumb. And it comes underneath the buttocks and runs behind the thigh. And once it gets to the knee, it branches out all the way to the foot into the big toe. So the best stretch that we can do for that, we're going to put it through different ones. First is just crossing your leg. Some of you may have a hard time bringing your knee down. When you do this, you may be up here. That's okay. You're just going to apply light pressure on the knee until you feel that buttock start to ache. You're stretching that piriformis muscle. And you're going to hold that there for a good minute as well. After a minute, what you're going to do is you're going to start to lean forward. As you lean forward, you'll feel more burning in that buttocks. That's good. Just go to the point to where you can't go anymore. Just hang out in that position. You can watch TV doing this and just allow it to continue to stretch. After that, you're going to start leaning to the other side as you continue to push down on that knee. As you lean to the other side, you can twist a little bit to the other side. You'll feel more stretching. You'll hold on to that about 45 seconds to a minute as you continue to stretch that piriformis muscle. So we need to be persistent to release that piriformis muscle. Those tight ligaments, those tight muscles and irritation on that nerve. We're going to open up the hip joint as well as release irritation and pressure in the sacroiliac joint. So let's sit back. Do not put your foot over your knee. Put it next to your knee. Keep the forearm down on your knee like this. Apply pressure down like that. Try to sit up straight. As you apply pressure, you'll still feel pressure and pulling in that buttocks area. That's good. Hold it there about 45 seconds to a minute. The same thing we did before. You can apply pressure with your hand to stabilize yourself on the couch. Keep putting pressure on that knee and lean to the side. You'll feel more of a stretch in that piriformis and that buttocks area. A lot of good release. And after about 45 seconds to a minute, as you keep applying pressure to the knee, we lean over. Now rotate your body away. And as you rotate your body away, you'll feel a deeper stretch, which we're going to get that irritation off that nerve. Great. So now I want you to sit back up, cross your ankle back over your knee. Now that whole area should be much less contracted. It's going to feel like you have more range of motion. Take your knee and just pull it up to your chest. You're going to hold that for a good 30 seconds to 45 seconds. You'll feel a lot of stretching in that buttocks area to a different angle. That different angle is going to release the irritation off that nerve, particularly on that piriformis muscle. You're going to pull it. I know a lot of you may be hurting. Just hold it to where you can hold it. Don't hurt yourself. As you continue to progress over time, your flexibility will get much, much more, and you're going to have a lot less pain. After you continue to bring this up to your chest area, now what I want you to do, I want you to pull it to your right shoulder or your opposite shoulder. Again, I'm doing my left side, so I'm going to pull it to my right shoulder. Now pull it over and up to your right shoulder. You'll feel more of a burning. Just breathe through it. Just relax. Take it to the point to where there's just tension. Don't hurt yourself. You hold that there up to a minute. Excellent. Now while we cross the knee like this, we're putting the hip into what we call external rotation. We're going to put the hip into internal rotation where we're going to cross it the opposite way. Take that same leg. Instead of us going like this, now we're going to go the opposite way. Try to bring your foot out the best you can. Some people can do this, some people can do this, and some of you may do this. Don't worry the position that you're in, just do your best. As long as you get your foot down in this position, you're doing good. So, the key thing here is, while you're in this position, you'll notice that your body will fall off to the side. It's much harder to sit up because as you sit up, you put more stress into the hip joint and into that internal rotation. So we want to sit up. So in this position, you may be over here. I want you to sit up as much as you can. The more you sit up, the more stretching you'll feel on the outside of that hip. I know a lot of you are saying, ow, ow, ow. That's okay. Just get to the point and just hold it there. Hold this for a good minute, a minute and a half, 2 minutes. This is extremely important because we want to balance out those muscles on the external rotation and the internal rotation. They work synergistically together. So this is a very important stretch that will help your lower back so you can heal much faster. And lastly, whenever a muscle is contracted, it's going to affect your pelvis. It can make one side become higher than the other. This particular stretch is going to level off and balance out those adductor muscles in the pelvis so you can get a lot of release in there that when you walk, it's going to feel a lot looser with less pain. Sit back on the couch. I want you to try to bring your feet as close as you can together. Now what I'd like you to do is take your elbows and just push down the inside of your thighs, right next to your knees. And a lot of you only may be about here or here. Many of you may be able to go all the way down. That's good. Just do your best and just continue to hold that position. You'll feel stretching all in the groin area. These muscles must release because the pelvic and the lower extremities work hand in hand. That when you have contracture, it's going to throw your gait off. It's going to throw your walking posture off and it can cause more problems. So continue to hold this down like this for a good minute or so. Remember, all these exercises and stretches we're doing on the couch, you could be watching TV while you're doing these stretches. So just continue to hold it like that. Now what I'd like you to do is grab your ankles. Continue pushing down. You're going to lean forward the best you can. The more you lean forward, the more you're going to feel it right in your groin. Keep going. Just lean forward. Push down, lean forward. And just hold it in that position for a good minute or so. And then when you're done, you're going to shake it off. Remember, the involved side you'll always do first. It's always good to stretch your other side. You may not have to do as much because you already might have a lot of the flexibility in there. When you have damage to an area, the body wants to compensate. It wants to shorten the muscle to protect it. So while those muscles are shortened, we need to elongate them. That will clear that irritation off the nerve so you can feel better. So let's summarize a few important things. All these stretches for your sciatica, for your low back pain, your buttocks aching, can be done sitting on a couch at home. Never exceed the pain threshold of what your body's talking or telling you. If the pain is too much, back off. The key thing is hold that position for 45 seconds to a minute, and you're going to get great results. Try to do these stretches daily if you can. This will really make a tremendous difference when you're having that irritation and inflammation in your lower back area. And one very important thing, make sure you're hydrating. That hydration, that water your body needs is important for your joints, your synovial fluid, as well as healing that goes on with your body. And when you sleep, I prefer you not to sleep on your stomach. If you're on your back, put a pillow underneath the knees. Keep the knees slightly bent. If you're on your side, put a pillow between the knees and your knees slightly bent. That will take a lot of pressure off those muscles and help open up the space where the nerve comes out between the vertebrae so your body can repair and heal. I know you'll get great results, but remember, always stay tuned in what your body's telling you. If you're having a lot of pain doing any type of exercise, or just doing anything throughout the day, listen to what your body's telling you. Don't push it, because everything does require time for healing. I hope you found this video helpful. Leave your comments below. I would love to read how this video has benefited you or your friends or loved ones. And most important, make it a great day. I'm Dr. Alan Mandell.